Hi everyone, Dr. Jeff back with you this week with co-hosted Magdalene, and it's always fun to be here doing these things, and Magdalene's got a great topic in this week, so what's happening this week?
We're going to talk about diabetic neuropathies.
Oh, exciting.
Yeah. So it's a common complication of diabetes where it affects your nerves. There's three types, including polyneuropathy affecting generally your hands and your feet, typically your feet. There's autonomic neuropathies affecting your organs, so it could affect your stomach, so your bowels, and your menstrual cycle and things like that. And also mononeuropathy, which a common one is of your optic nerve, causing difficulty with vision.
Yeah, I've had a number of patients who with diabetes that have started to lose their vision because of their diabetes. So what happens with consistent high blood sugar? It can be very toxic to your nerves. So your nerve ends will start to die off, and this causes funny sensations or whatever. This could be, it's all different. Some people will find they get numbness or tingling. Some people it's a real sharp pain. Some people it's a burning pain. Really quite different with each person as far as what they feel is concerned. As far as muscles are concerned, it can really affect your hands and your thumbs and your wrists. And your calves and your feet, and they start to get weak and not as controllable. And this can cause real issues because if you can't feel your feet, you can't feel the terrain, you don't know what you're stepping on, and this can lead to falls, which is a very big issue with diabetics because they can't feel anything. They also, if they step on something hot, they can't feel it. You step on a pencil or a nail, not good. Also, they can't feel their feet as much, so a sock may be rolled up in their shoe or the shoe's not tied on properly. This can lead to blisters or ulcers. And we all know with diabetics, when they get ulcers or blisters, especially on their feet, their circulatory system's also compromised, so it's more difficult for them to actually heal with that. So it's something to be very, very concerned about.
Yeah. So when it comes to prevention, you want to have a proper lifestyle where you're maintaining a good diet, you're exercising regularly. You may want to contemplate taking some vitamins like B vitamins. They suggest B1, B6, and B12 vitamins. And you may also want to take fish oils.
Yeah, those are all good for preventing and helping your nervous system function in a better way. As far as with diabetic neuropathies, quite often they're going to go up and down. So you're going to notice they kind of get worse and then they start to get a little better, especially if you start to control your blood sugars a little better. But then they get worse again a little better, and generally they never come back 100%. Generally it's just progressively get a little bit worse. As far as medical treatment for this is concerned, generally they just kind of treat it symptomatically. So at first they may give you some Tylenol or some anti-inflammatories, try and help with some of the pain and everything. If the nerve pain is getting quite bad, they'll give you some nerve medication, Lyrica or gabapentin or something like that, again to try and treat you symptomatically. So the one thing you want to do if you are diabetic is really, really make sure you maintain that blood sugar properly to try and prevent any of these neuropathies from actually starting to occur. It doesn't happen with everybody, but it is quite common with diabetics. So try and maintain that, as you mentioned, a good lifestyle, control your blood sugars, and try and prevent anything from this happening, because when you get it, it's not that pleasant.
Absolutely. Alright, so if you liked our video this week, make sure to give it a like and subscribe to our channel. If you have any questions, don't be shy to email us. And if you have video topic ideas, send them over. And as always at Goldsworthy Wellness, we got your back.